career in medicine is nothing short of demanding. Long, intense schooling, constant training, and a chaotic schedule with a dose of tenacity and patience. Well, but when I'm asked as to why I chose to be a physician, or when I ask this question to my colleagues, the same theme emerges. The desire to help others lead a healthier and happier lives. It is a fulfilling job when you help just facilitate other people's health regardless of circumstances. But this brings me to the second question. We think we help people, but are we really effective? To answer this question, I looked at two main things. Number one, before you could help others, are we helping ourselves? In other words, what does the science or the data tells us about physicians' longevity and their own health? Physician mortality is of particular interest to answer this question, as it may give input regarding their own healthful and lifestyle choices, which may impact their patient counseling practices. So let's see what the data says. Number one, it was found that both white and black men as a physician tend to live longer unto about 73 years of age when compared to lawyers, 72 years, compared to professionals, all college graduate professionals, about 71 years, and all men in general, about 70 years. The second study looked at the healthcare practices and screening behaviors of women physicians. Suffice it to say that women physicians exceeded all national goals regarding screening practices, preventive healthcare, and healthy habits when compared to women of similar socioeconomic status, and also better than all US women in general. These data help to erase the myth of an unhealthy physician. Number two, this shows the doctors are effective in improving their own healthcare. But how about their families? A randomized study out of Sweden tried to answer this question. The research found that having informal health expertise in the family, such as in the form of a doctor or a nurse, reduced the likelihood to die before age 80 by about 10%. Such families were less likely to have chronic illnesses such as cardiac disease, diabetes, or obesity. It also improved the health outcomes of younger individuals who were more likely to get vaccinated, less likely to have drug or alcohol abuse problems, less likely to have hospital admissions, and fewer hospital or emergency room visits. Additionally, the closer the family source, either geographically or in the family tree, more pronounced the health benefits. So the takeaway, we pour a lot of resources in making our healthcare fancy with very new, improved gadgets. But what we really need is the old-fashioned primary care doctor, where the entire family goes to the same doctor for years, developing that family connection, developing a closer proximity, developing effective communication is what leads to investments in preventive care, and that has lasting benefits improving longevity. And that is what the healthcare needs to learn. Doctors can be effective only when the connection is right and apt. Thank you very much for listening. Stay safe and keep smiling. Please let me know your thoughts in the comments below. Please subscribe and follow for more. Thank you so much.